Here's what we'll cover in this video. For the first time, a blood draw can help diagnose Alzheimer'S with accuracy that rivals a spinal tap or a brain scan. Until recently, confirming Alzheimer'S meant an invasive spinal tap or a PET scan costing thousands of dollars, often out of reach. Alzheimer'S was first described in 1906. It took until the 2020s to find a blood marker accurate enough to matter. Inside the brain, two things build up: sticky amyloid plaques between neurons and tangled tau protein fibers inside them. The blood test measures two things: a form of tau called p-tau217 and the ratio of two amyloid protein fragments. As tau tangles form inside dying neurons, fragments of that tau protein leak out, cross into the blood, and become detectable there. Among all the tau variants tested, p-tau217 consistently outperforms the others, with accuracy scores between 93 and 96 out of 100. In specialist clinics, accuracy runs about 90%. In primary care doctors' offices, it drops slightly to around 85%. Kidney disease and advanced age can throw off the numbers, since both affect how the body clears these proteins from the blood. Encouragingly, accuracy held up almost equally well across racial groups in recent validation studies, 0.88 versus 0.91. Picture a 68-year-old with memory complaints. A blood draw at her first visit points her doctor toward or away from a costly confirmatory scan. Quick pause. If this breakdown is helping you, take a second to hit like and subscribe. It genuinely takes a lot of effort to make videos like this, and your support keeps them coming. Using two cutoff points instead of one pushes accuracy up to 92 to 94%, while flagging uncertain cases for further testing. Several versions now exist: Lumipulse ratio test, Roche's Alexis test for primary care, and C2N's mass spectrometry-based option. Where a PET scan can run several $1,000s, this blood test now costs roughly $200 a draw. Myth: this blood draw alone diagnoses Alzheimer'S on the spot. Fact: it's a triage tool, still paired with clinical judgment and often confirmatory testing. It's cleared specifically for adults 55 and older who already have memory or thinking symptoms, not for healthy people with no complaints. It's explicitly not a population screening test. False positives and false negatives both happen, especially with borderline results. A positive result can open the door to confirmatory imaging, clinical trials, and newer anti-amyloid drugs, plus real time to plan ahead. So getting real answers about Alzheimer'S may now start with a simple needle in your arm, not a needle in your spine. Quick check: which biomarker consistently outperforms the others in detecting Alzheimer'S pathology from a blood sample? Here are the key references and sources for this video. Thanks so much for watching. If this helped, like the video and subscribe for more clear, simple explainers, and I'll see you in the next one.